Hello, everyone. Today we're going to explore how natural remedies and dietary supplements can support reproductive health in both men and women. While many people turn to medical procedures like IVF or hormonal therapy when facing fertility challenges, fewer are aware that certain natural ingredients can significantly improve their chances of conception in a safer, more sustainable way. The key principle here is simple. Enhance your body's natural capacity to conceive by correcting nutritional deficiencies, balancing hormones, reducing stress, and protecting reproductive cells from damage. Unlike invasive treatments that force abrupt hormonal changes, natural remedies work gradually, creating a more favorable environment for conception. Understanding how natural remedies work. Let's understand the basics. Fertility depends on a delicate hormonal balance and healthy cellular processes. In women, regular ovulation and quality eggs are essential. In men, sperm count, motility, shape, and DNA integrity determine fertility potential. Natural remedies work through four primary mechanisms. First, they regulate hormones by improving communication between your brain and reproductive organs. Second, they reduce oxidative stress that damages sperm and egg cells. Third, they provide essential nutrients for DNA synthesis and cell division. Finally, some herbs improve your stress response, which is crucial because high cortisol suppresses reproductive hormones like testosterone, estrogen, and progesterone. Here's something important to remember. Natural supplements aren't quick fixes. Most fertility improvements require at least 3 months, which is the average time for sperm development and egg maturation cycles. Ashwagandha, the stress-busting fertility herb. Let's start with ashwagandha, one of the most powerful Ayurvedic herbs for fertility. It's an adaptogen, meaning it helps your body manage stress by controlling cortisol levels. Why does this matter? Because chronic stress suppresses the hormones you need for reproduction. In men, ashwagandha improves semen quality by enhancing testosterone, improving sperm movement, and increasing semen volume. Clinical studies show that taking 5 grams of ashwagandha powder daily for 3 months significantly improves sperm concentration and motility in men with infertility. In women, it helps correct hormonal imbalances, especially stress-related irregular periods or lack of ovulation. It can also improve thyroid function, which, when underactive, may contribute to infertility. The typical dose is 300 to 600 milligrams of standardized extract twice daily, or 3 to 5 grams of root powder before bedtime. Take it consistently for at least 3 months with food to avoid stomach irritation. Zinc, the critical mineral. Zinc is absolutely critical for reproductive function. It plays a direct role in testosterone production, DNA formation, and cell division. In men, zinc deficiency commonly leads to low testosterone, poor semen volume, and weakened sperm structure. Here's powerful evidence. Men given 30 milligrams of zinc daily for 3 months showed more than 70% improvement in sperm motility and significant increases in sperm count. That's remarkable. In women, zinc is essential for egg maturation and ovulation, and it supports the hormonal interaction between ovaries and the pituitary gland. You can get zinc from meat, shellfish, pumpkin seeds, legumes, and dairy. However, plant sources have lower bioavailability, so supplementation may be needed. The recommended dose ranges from 15 to 30 milligrams daily. Don't exceed 40 milligrams unless prescribed, as excessive intake can interfere with copper absorption. Vitamin D, the hormone-like vitamin. Vitamin D acts more like a hormone than a vitamin, and its deficiency is directly linked to infertility. In women, low vitamin D levels increase infertility risk, especially in conditions like PCOS, decreased ovarian reserve, and endometriosis. It supports follicle development and embryo implantation. In men, vitamin D supports testosterone production and may improve sperm motility, particularly in unexplained infertility cases. Research shows that men with adequate vitamin D levels demonstrate higher fertilization rates in assisted reproductive procedures. Antioxidants, fighting oxidative stress. Oxidative stress is one of the most common causes of infertility. Free radicals damage cell membranes, impair DNA, and reduce the viability of reproductive cells. Sperm are extremely sensitive to this damage due to limited antioxidant defenses. Egg cells suffer similarly. Key antioxidants include vitamin C, vitamin E, coenzyme Q10, selenium, and beta-carotene. Vitamin C prevents DNA damage in sperm cells. Vitamin E improves reproductive cell membrane health. CoQ10 supports mitochondrial function, which is essential for energy production in sperm and eggs. Selenium protects against oxidative damage and supports hormone regulation. For dosing, vitamin C is typically taken at 500 to 1,000 milligrams daily. Vitamin E is usually 400 IU. CoQ10 may be prescribed between 100 and 300 milligrams daily, particularly for men with infertility or women undergoing fertility treatments. Selenium is typically 50 to 200 micrograms daily. Clinical evidence. Let me share some compelling research. In controlled trials, men with infertility who took ashwagandha extract for 90 days showed improved sperm concentration, motility, and semen volume. Another study demonstrated reduced cortisol and enhanced testosterone production. Zinc-deficient men experienced nearly 80% improvement in sperm motility after just 12 weeks of supplementation. That's transformative. Vitamin D deficiency has been correlated with poor reproductive outcomes in both sexes. Clinical research found that adequate vitamin D levels are associated with improved embryo quality and implantation in IVF patients. Antioxidant supplementation, particularly CoQ10 and vitamin C and E, has shown improved sperm motility and reduced DNA fragmentation. In women, antioxidants support ovarian function and reduce oxidative stress, especially in endometriosis. Most studies conclude that natural supplements produce favorable changes when taken consistently for at least 3 months, combined with healthy lifestyle modifications. To summarize, natural fertility support works by addressing the root causes: nutritional deficiencies, hormonal imbalances, oxidative stress, and inflammation. The most effective supplements include ashwagandha for stress management, zinc for sperm and egg quality, vitamin D for hormonal regulation, and antioxidants for cellular protection. Remember, these aren't quick fixes. Commit to at least 3 months of consistent use, combine supplements with good nutrition and lifestyle modifications, and work with healthcare professionals to optimize your approach. Whether you're trying to conceive naturally or preparing for assisted reproductive procedures, natural remedies can create a stronger foundation for fertility success. Start with testing to identify your specific deficiencies, choose quality supplements, and be patient with the process. Thank you for watching, and best wishes on your fertility journey.